You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
Can you just talk about the dialogue that you're having with your colleagues in other states as well, and how they are dealing with the physical and the mental and emotional toll of treating victims? I read some stories over the weekend, and I read this one story out of Massachusetts where these doctors went through every possible measure to save this guy's life, and eventually they did, but they were just destroyed about they could not figure out how, pretty much they say, according to this story, his lungs, the x-ray, it was essentially white. They couldn't even see his lungs. And they were just trying everything. And luckily the guy survived, but they said it was just unbelievable. And so I don't think, I don't think people really understand what happens when people in the healthcare industry, they're just seeing death after death after death and not being able to figure out how to stop this.
Right. Yeah, it's a big challenge. From an emergency standpoint, there are a couple of hats I wear. So in my dialogue with my colleagues, it's a little bit different. I was a military guy. We did kind of this type of stuff. We saw death, but also as an emergency trained physician and a pediatric expert also. So I've kind of seen the whole impact from that standpoint, from the end user perspective, also to the biodefense, which I used to advise the Obama administration on. So I get the global picture, but when it comes down to seeing patients and dealing with death, we don't get numb to it in a sense when it's something challenging enough. Meaning in our day-to-day, so in emergency, so if I'm seeing an adult or a kid, we'll respond. We're known to go running, kind of like firefighters, and go put out the fire and do what we need to do. And we have a dedicated mission and a dedicated team, and we'll save patients. Sometimes we do lose patients, and it takes a big toll on us. But as the lead, when you're lead, sometimes you can't show that emotion out of not being weak, but also being strong for the team. But we do things what we call debriefs, something we got from the military also. But we would debrief and go over those and say, like, hey, we tried to do this for this patient. What could we have done better? People get to vent. We get chaplains involved, all those types of things, which are resources for the staff and team if they need to vent or if something's going on. But with the volume and masses that some hospitals have seen with these cases, it has been overwhelming. It's sad, the story you mentioned about the doctor who committed suicide. That's very rare, but it does happen, and it can take a toll, especially on the provider. Yes, we wear our Superman or Superwoman armor, but sometimes we also, at the core of it, we're human. And when we can see our relatives, our family in those people, what if that's my aunt, uncle, or friend? Those types of things, and then you start to really feel the impact of it. This is real. There are lives that have been lost, and there will be still more lives lost, and we all are in it, and we have to figure out how best to get through it. With the colleagues, they've complained in terms of the testing, the equipment, all the things and issues, and the lack of leadership from the top. I mean, it's been a concatenation of different types of missteps, from the testing issue and all of those things, lack of equipment. But from my perspective, we've kind of seen this coming. We've been calling this out over 20 years for saying, hey, be prepared for pandemics, be prepared for biological disasters, other types of things that we see. And we see these experiences, and it seems like we either forget. We have this lessons re-experienced, as I call it, and many of my colleagues talk about it, where we learned this during H1N1, we learned something similar during Katrina. I'm not saying these are all on the same level, but there's a big disaster that occurs, and then we want to now chase after it and try to do it when we should have been more prepared before. I hope with all this experience and sadness that we also experience and hurt, out of this is born some significant changes that actually help us and even help our communities where we have the health disparities that are another issue and another layer onto that.
All right, Dr. Dan, I certainly appreciate it, man. Thank you so very much. Be sure to take care of yourself as well as the other docs and medical personnel out there, because y'all are on the front line and we definitely need y'all at full strength.
Thank you. Appreciate it.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.